Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore the main differences between the types of cervical cancer, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Cervical cancer mainly falls into two categories: squamous cell carcinoma and adenocarcinoma. Both types are named after the cells from which the cancer originates. Squamous cell carcinomas begin in the thin, flat cells lining the bottom of the cervix. This is the most common type of cervical cancer, accounting for about 70% to 90% of all cases. They typically develop slowly, initially starting as a precancerous condition known as dysplasia or cervical intraepithelial neoplasia, CIN. Adenocarcinomas, on the other hand, originate in the glandular cells lining the upper portion of the cervix. While less common, incidence rates of adenocarcinomas have been gradually increasing over the past few decades. This form of cervical cancer can be slightly more challenging to detect with cervical screening tests because of its location in the cervix. A third, much less common type is adenosquamous carcinoma, which has features of both of the other types. The risk factors for both types of cancer are similar, with human papillomavirus, HPV, being the most common cause. Other factors include smoking, a weakened immune system, long-term use of oral contraceptives, and multiple full-term pregnancies. The symptoms for both types can also be similar, often including abnormal vaginal bleeding, unusual vaginal discharge, or pain during sex. However, in many cases, symptoms don't appear until the cancer has advanced, which underscores the importance of regular screening. Despite their similarities, these two types of cervical cancer can sometimes respond differently to treatment. While both can usually be treated with surgery, radiation, or chemotherapy, adenocarcinomas may be less responsive to radiation therapy. The prognosis for both types depends on several factors, including the stage of the cancer when it is diagnosed and the patient's overall health. However, the survival rate for squamous cell carcinoma is generally slightly better than for adenocarcinoma, partly because it is often detected earlier. In summary, while squamous cell carcinoma and adenocarcinoma of the cervix share many similarities, they originate from different types of cells, develop in different parts of the cervix, can sometimes respond differently to treatment, and have slightly different prognosis. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.